Hello and welcome. My name is Jody Scholes. I'm your instructor for the MBLEx Review Course. And the topic of our class today is benefits and physiological effects of massage. Now, this is going to be about 15 questions on your MBLEx. Our class is going to go in 3 parts. The first part, I'm going to give you some test-taking strategy. The second part is learn, learn, learn. And then the third part will be dissecting questions. So let's get on to it. In this very first segment of class, I like to give you some test-taking strategies. For those of you who've taken the test in the past, you'll know that it's not just knowledge that you need to pass the MBLEx. You need a strategy. You need some test-taking strategy. And one of the things we specifically focus on in this community is building your test-taking stamina. Now, what does that mean? Stamina is your strength, your ability to focus, your mental stamina. Most times we think of physical stamina versus mental stamina. So physical stamina, I'm tough. I can run 5 miles. I can work out at the gym for 2 hours. Physically, I can go to work and I work in a warehouse and I can move boxes all day long. That's what we typically think of as stamina. However, a very important part of the MBLEx is having mental stamina. And one way you can test your mental stamina is how long does it take when you're reading a book for you to get tired or sleepy? Now, some people read a book to go to sleep, and that's great. If that's how you go to sleep, that's lovely. Putting good thoughts into your head prior to sleeping is a positive thing. But in general, if you're just going to sit down and you're going to focus on a project, and look, I am notorious for my unfinished projects or finishing projects like 3 or 4 at a time. I find it sometimes I have to really set an intention to focus. Do you find that happens with studying too? Like, okay, I'm going to sit down, I'm going to study. Oh, wait a minute. How about we sweep under that couch? Oh, wait a minute. I think the refrigerator needs to be cleaned. All of a sudden you're distracted. So mental stamina is something we focus on here. We build our ability to intentionally focus. We build our test-taking stamina. Yes. You ready to do a little learning? Let's get to it. Welcome to the benefits and physiological effects of massage. All right. We are all set. Oh, you can see I have a little friend here today. Hi, friend. Getting settled in. Mickey is also listening to class. All right, the benefits and physiological effects of massage. And welcome back. There are benefits of massage to every system of the body. In this time frame, in this class today, we don't have time to cover all the different systems of the body. So we're going to focus on 2 of them. And those 2 are the integumentary system and one other. But it'll be in the, we have many different lectures on that in the patron community. Just search under benefits and you'll see all of the videos that cover different systems of the body. All right. Let's start with the integumentary system. The skin, nails, hair, hooves, all these different things are included in the integumentary system. So it is comprised of the skin. And all of it, so hair, scales, feathers, hooves, nails. So our hair, our fingernails, our toenails, our skin is all considered a part of the integumentary system. It is also the largest system in our body. So if you're asked about that, it's not the muscular system, it's actually the integumentary system. So let's take a look at the different levels of our skin because you may be asked about this in terms of how massage is benefiting the skin. Let's take a look at how the skin is layered. So we have the epidermis, EPI, epidermis, that's the top layer. If you have an EpiPen, right? So the dermis is the middle layer, and then you've got the hypodermis. Let's take a closer look at the epidermis. Oops, there's the dermis, and then hypodermis. Yes, it's also sometimes called the subcutis. That would be like subcutaneous fat. That is where, so that's, you'll see this in another picture, but the hypodermis, hypo, low, is also called the subcutis level at times. So what does each layer of the skin do? Let's start with the epidermis. So the skin's role is just to protect us, right? It's our encasing. It protects us from bacteria. It repels water. If you're playing in the mud, um, it also protects underlying structures. So it's that casing that keeps us all in one piece. Mm. So the skin minimizes the loss of water, but it does allow for us to sweat. And it's protecting these underlying layers, like I mentioned, such as our blood vessels, so the veins, the arteries, our nerves, and of course, encasing our organs as well. So I like to, I think of it kind of like a sausage. The skin is the casing. All right, what does the dermis do? That's the epidermis, but what does the dermis do? So the dermis is that middle. All right, take a breath. A lot going on in the integumentary system, right? Let's just take a breath and get centered. Is there a lot going on for you today before class? Yeah, it's all good. It's all good. In fact, feel your feet. Feel your feet on the floor. Feel your feet in your shoes or in your socks or on the floor. Just wiggle your toes. Flex and extend your toes. Flex and extend your toes. Yeah. Just take a moment and get present. Yeah. All right. Ready to move on? The next category, the muscular system. Woo-hoo. It's an easy one, right? The benefits of massage for the muscular system. Ooh, well, let's dust off some brain cells. Ready? So let's talk about the mechanical and the reflexive effects of massage. So it has specifically to do with all of the systems of the body, but we're going to talk about it in terms of the muscular system. So we've got two different types of effects of massage, mechanical and reflexive. We're going to talk about both. And almost every massage therapist has a challenge with distinguishing the differences between the benefits of massage. Are they mechanical or are they reflexive? So let's get specific. The mechanical effects of massage are when something from the outside in makes a change. So the tissue is kneaded, lifted, rubbed, compressed, it's manipulated. So something from the outside is coming in and affecting a change. So what does that look like? Usually it looks like one of three strokes: compression, cross-fiber friction, or tapotement as a mechanical effect. So we're going to look at reflexive in just a moment. But outside force is changing something. So I'm taking my fingers, my knuckles, my thumb, I'm doing some cross-fiber friction on a scar, and I'm breaking up the scar tissue. I'm using a compression, and the image that's on the screen here, you see it's a compression. Now this is CPR. I wanted to compare compression in CPR to compression that we do during massage. So you will be taking CPR and life-saving for as a requirement for your state license. And you can do that right now, by the way. You want to knock that out? Go for it. And you'll learn how to do compressions. So short, fast, about 120 per minute. But we compress in CPR because we are mechanically breathing. We're mechanically pumping blood through the heart, right? We're mechanically pumping blood through the heart, just like as if the heart was pumping itself. That's what those compressions are doing. That's why compression is typically a mechanical effect. Is if we're doing compression, the effect is mechanical. We're doing it. We're actually pushing blood through the heart. We're taking soft fists and compressing on the glutes. So that's creating, the compression is creating what's called a temporary ischemia. Yeah, we'll talk about that word in just a moment. The other part of mechanical effects is tapotement. So we can pound, anything percussive that is breaking up the mucus. So typically we do this on the back, but that is tapotement, percussive breaking up, shaking, or jostling of the mucus that is maybe dormant in the lungs. Those are mechanical effects of massage. My thumb is breaking up scar tissue. I'm the machine. Compression. We're a machine. We're compressing. We're breaking. We're moving some blood out of an area. And tapotement, again, shaking, jostling, a mechanical effect. So from the outside, coming in and affecting a change, compared to the reflexive effects of massage. The reflexive effects of massage are involuntary. Involuntary. The body is just doing it on its own. And I will tell you, the majority of benefits of massage are reflexive responses. I would say 80% of the time, reflexive. In fact, I would suggest, and I do this often, start with that it's a reflexive effect. So these are the effects like the blood pressure goes down, the heart rate slows down, deeper breathing, more rhythmic breathing. Now, you may instruct your client to take a deep breath, but when they do it on their own, that is a result of the parasympathetic nervous system kicking in. It's a reflexive response. It's a reflex. They didn't think about it. So most of the benefits of massage are reflexive. The body is doing it on its own. So just so you understand. So let's look at a couple of terms. So in context of the muscular system, there are 680 muscles in the body. You don't need to know them all, just the big ones. About 150 or so. But there are three types of muscles in the body. So we've got smooth muscle, we have skeletal muscle, and we have cardiac muscle. 2 of these are involuntary. 1 is voluntary. Which do you think is the voluntary? Voluntary. Voluntary. There we go. Which one of these is voluntary muscle? Smooth, skeletal, or cardiac? So that means
Cardiac.
thank you. Yes, exactly. Yes. Actually, sorry. No. My mistake. So cardiac and smooth are involuntary. Skeletal is voluntary. So the skeletal muscles that move our skeleton, we are saying, okay, flex and extend at the elbow. Flex and extend at the elbow. Cardiac muscle beats our heart. Smooth muscles appear in the digestive tract. Those both work involuntarily. Cardiac to beat our heart. We don't think about that, right? Digestion, the movement of digestion, the peristalsis that moves food, digesting through our intestinal tract. That's called smooth muscle. That also works involuntarily. But let's take a look at the benefits of massage for the muscular system. So, of course, it relieves muscle tension and relaxes muscles. It helps them to recalibrate, to be more efficient. All right, let's switch gears. So let's take just a moment, a little moment of a break here. Moment, it's just like a quick little 10-second. We're going to switch gears into dissecting some questions. Yeah, changing gears. All right, here we go. The question reads, all of these are benefits of massage to the connective tissue, except. All of these are benefits of massage to the connective tissue, except. This is an example of a switcheroo on the question. So it's asking you, all of these are benefits except for, so we're looking for the answer that is not a benefit of massage. So I demonstrate this question because sometimes you get these on the MBLEx. We're looking for that thing that is not a benefit of massage. You clear? Good. All right, your options. Decreases adhesion. So the other part of this question is the connective tissue. You might see an answer that is a benefit of massage, but not to the connective tissue. So all of these are benefits, but one. So decreases adhesions, releases fascial restrictions, slows down connective tissue healing, reduces surface dimpling and of cellulite. Yay! Good. All right, Heather got it. Rose, hey. Nice job. Yes. Nuyo, yes. Aite, yes. Franzi, yes. Good. Excellent work, guys. Let's eliminate, I think we eliminate one. So we know it does it, that's a benefit of massage. It decreases adhesion formation. The best answer is yes, letter C. It does not slow down connective tissue healing. It increases the connective tissue's ability to heal. Oh, we have more. Okay, couple more. Maybe I think this is the last one. What does the epidermis do? Talked a lot about skin today. So let's read through your questions. What does skin do? And this is a question that has 5 answers. On your MBLEx, you may see that you may see that you have somehow have 3 answers. Many will have 4, some will have 3. In this case, we have 5. So that does not exactly simulate the MBLEx. All right. What does the epidermis do? Protects from bacteria, minimizes the loss of water, protects underlying structures, such as blood vessels, nerves, and organs. All of the above, none of the above. Well, let's eliminate one wrong answer. We know it does some of these, right? We know it does some of these. What is the best answer? Oh, we are all over the board here. Some good questions today, huh? Everyone's all over the board. What does the epidermis do? You ready? Best answer? All of the above. Yes. Letter D, all of the above. I hear you. Protects from bacteria. What are you talking about? It does. It's actually one of the best ways that we protect ourselves from bacteria. It bounces off our skin. Yeah. Minimizes the loss of water. That's a tricky one, right? But we did mention it. It helps us to stay hydrated. I know. I know. You also sweat. Yes, you do sweat. So we release water, but it minimizes. Yeah, I know. Tricky, tricky. Remember this image? So skin minimizes the loss of water, protects underlying structures such as blood vessels, protects from bacteria. Yeah, yeah. See what I'm talking about now? Yeah. I know it's just worded funny, right? And we just have to be very careful on the MBLEx. Look, you're not going to get every question right on the MBLEx. Just not going to happen. That's okay. We're going to use the techniques we're learning right now where we read the question, we fully understand the question, and then we eliminate answers we know are wrong, and we pick the best answer.
I have a question.
Sure, hang on just one moment. Oh, go ahead, Valerie. Go ahead. Is it related to this question?
Yes,
Go for it.
it said all of the above.
Mm-hmm. It is all of the above.
Right. But the last answer was part of all of the above. That was really cheating.
You got
Uh,
me on that. You do, you got me. If we go back a slide, yep. So all of the above. So yeah, none of
well,
the above. Technically, it should have been all of this, but it can't be all and none. So that is, I guess we can't have both in that question because that's too true. That's yeah. It wouldn't have been all if all was letter E, then it wouldn't have worked. Thanks for asking.
that's crazy. You gotta really have your thinking cap on.
Do I know? I know. I know. Yes. All right. What level of the skin is responsible to store fat, anchor the skin, and acts like a shock absorber? The hypodermis, the epidermis, the dermis, or the hypodermis? Now, if the answer's popping in, let's eliminate one wrong answer or one answer we know is wrong. There's no such thing as the hypodermis. Yeah, it's the epidermis is the top layer, right? Okay, let's see what the survey says in the chat. I'm liking it. Let's see. All right, we got answers again all over the map. Where is the fat stored? That's a key part of this question. Uh-huh. Acts like a shock absorber. That's a couple layers. Boom. Best answer, letter A. The hypodermis or the subcutis, right? Subcutaneous fat. That's where the fat is stored in the hypodermis or the subcutis. Yeah. Good questions today, huh? Nice work. Excellent, excellent work today. Yeah. So let's Good job today, you guys, for real.